Coming up on Network Africa, World Health Organization is calling for caution as African airlines begin operations in various countries. Doctors in Sierra Leone begin strike, leaving COVID-19 patients stranded. Plus, Botswana investigates mysterious deaths of hundreds of elephants in the Okavango Delta. Thank you for joining us this hour. I'm Layo Adegoke. The World Health Organization is calling for caution as African airlines begin operations in various countries. WHO says strict measures should be observed to prevent surges in coronavirus infections and governments to ensure airlines take information of passengers traveling and follow up with them to prevent outbreaks. According to the Regional Director for Africa, Dr. Mashidiso Moeti, air travel is important for the economy, but this new normal still requires stringent measures to stem the spread of COVID-19. WHO is therefore advising airport officials to ensure social distancing, hand washing, and sanitization. Well, some countries across the continent have either resumed air travel or are planning to. For example, Cameroon, Equatorial Guinea, Tanzania and Zambia have resumed commercial flights. Even Tunisia reopened its airspace to commercial flights on June the 27th, so also Egypt. Nigeria is set to begin domestic flights on July the 8th. While the WHO claims it understands reasons behind resumption of international travel, it is still calling for caution, citing the surge in infections in the Seychelles related to travel in the last week. Just to recap, the country recorded 66 new cases, all crew members of an international fishing vessel. Let's talk about the concerns and possible impact of resumption of international travel. African Affairs Analyst Ejeta Otuonio, he joins us now via Skype from Lagos Island. Thank you, sir, for joining us on the program.
My pleasure.
Let me start by... Good afternoon. Well, the World Health Organization is calling for caution as airlines across the continent restart their operations, basically for health reasons. Now, this pandemic is still active on the continent. Do you think countries should go ahead and reopen airspaces for air travel, both domestic and international?
The health aspect of the pandemic has been quite devastating. The economic impact as well has done critical damage to world economy, and especially Africa, that is most dependent on the outside world for most of its economic activities to run. It's something that it's standing between the rock and the hard place, if you ask me. The WHO's advice is timely, but the challenge that Africa is facing currently is much more than the advice that the WHO is given, because the WHO has not been able to situate or place its finger on the prognosis or the diagnosis of the pandemic, as it were. So it's important that since the lockdown is very relaxed, the tourism as well as the air travels also should begin to look at possibility of also relaxing the lockdown so that the businesses can thrive. Because the worst hit industries have been the tourism industry as well as the air travels, and Africa also does not have the stimulus packages that the Western countries are offering their airlines. I'm sure you know that most of the airline businesses or the air travel businesses that they run in Africa, mostly on leases. And the cost of maintaining airlines is something that will sink a nation, if you ask me.
Speaking of the Western countries, as we know, the coronavirus was imported into the continent. The first case was recorded in February, and that was in Egypt. And almost 5 months after, we now have over 432,000 cases. More than half of that number is still active. The others have either recovered or died. Should African countries, approach the issue of reopening international travel just like the EU has recently done?
I didn't get your questions. Sorry, please.
I was
Post it again.
asking, I was asking if African countries should do just like the EU has done by, reopening the international airports, knowing that the coronavirus was imported into the continent.
Now, there is nothing that is stopping African nations from reopening the way the EU nations have done. If you notice, the EU nations also place restrictions on some high infected nations, one of which is the United States of America. But I do not know whether it will bode well for African nations to also place similar restrictions on countries where the infection is skyrocketing, or it's, For example, a nation like Brazil is really under the effect of a rise in the number of infections. But like I've said, there has to be a new normal, and that is the language in the international community, in the world already. The world is waking up from a difficult situation of a pandemic, which I'm sure the world had not experienced in the last 100 years after the Spanish flu and the bubonic plague. So we have to learn to live again. And learning to live again means that we need to pick up our economic activities from where we dumped them. The effects of not doing that is beyond recall. Most African nations now are having very serious economic challenges as a result of the effect of this pandemic that is refusing to go away. So it's learning to live with it. It's a new normal. So it's a good sign, it's a good omen that the airline industries are beginning to pick up again, and that we just need to put
Ejeta Otuonio, African Affairs Analyst, thank you so much for speaking to us on Network Africa. Thank you for your thoughts. Well, the South Africa Defence Force has confirmed that at least 40 of its officers have tested positive for coronavirus. The troops are from an infantry battalion based in Cape Town and had been identified to be deployed to the northern Limpopo province. The Defence Forces says, like all other frontline workers, SANDF soldiers are exposed to the scourge of COVID-19 more than the average citizen. The force said it had taken all the necessary health precautions before the soldiers went to Lefalale to augment another battalion on safeguarding role on the border between South Africa and Zimbabwe. Well, a doctor's strike in Sierra Leone has left COVID-19 patients in some of the main treatment centers without care. The doctors say they were promised hazard pay for their work during the outbreak, but have not yet been paid. The strike marks an escalation in a row between doctors and government over what doctors say is a misuse of funds for the coronavirus response and a lack of protection and compensation for health workers.
Any patient that is showing COVID-like symptoms will not be attended to by any doctor. That is the decision.
This is the plight of COVID-19 patients as doctors treating them are on strike. Doctors in Sierra Leone say they were promised hazard pay for their work during the coronavirus outbreak, but that pay has not come. They also complain of a lack of protective equipment like gloves, masks, and coveralls, vital to prevent infection spreading from patients to hospital staff. However, they still remain at work, but just for non-COVID-19 patients.
So, but we still remain in the hospitals attending to non-COVID patients. So in other words, we are still part of the hospital settings, but we are outside the response at the moment, owing to the fact that our allowances are not paid as per MOU.
No new patients are being accepted because the 5 doctors at the 200-bed facility are all on strike, leaving community health workers and nurses to care for the sick. Dr. Jusu and other staff acknowledge that this could lead to a rise in cases in the community.
If doctors lay down tools, then most of the corona patients will go out of the treatment centers. And secondly, those who will be diagnosed of the disease will not come to treatment center because they know doctors are not there. So they will, in fact, embark on this self-isolation, which is a mere risk.
Since the outbreak began, according to procurement reports released by Sierra Leone's finance ministry, the only medical equipment listed was 8 ventilators, which cost approximately $82,285 out of 20% of the country's total coronavirus expenditure.
We'll have more stories on the COVID-19 pandemic, but in the meantime, let's take a look at other stories outside the virus. In France, an appeals court has rejected a request to reopen an investigation into the shooting down of a plane carrying Rwandan President Juvenal Habyarimana 26 years ago. The downing of that plane was what sparked the Rwandan genocide in which 800,000 people were killed. The inquiry was dropped in 2018, but Habyarimana's widow, Agathe, and families of other victims had appealed against the decision. But it may not be the end of the case, as civil parties have already said they will move to a higher court. Relations between France and Rwanda have been turbulent ever since a French judge in 2006 accused several close associates of current Rwandan President Paul Kagame of being behind the assassination of Habyarimana. Well, Côte d'Ivoire is honoring 14 soldiers who were attacked and killed on a military post near the country's border with Burkina Faso in June. The incident is the first assault by Islamist extremists on Ivorian soil since March 2016. President Alassane Ouattara, who attended the ceremony, spoke with families of the victims who were seen mourning their relative. Well, Botswana is investigating the deaths of hundreds of elephants whose carcasses were found dead in the country's Okavango Delta. The carcasses were found intact, suggesting they were not poached. Further investigations have also ruled out poisoning by humans and anthrax, which sometimes hit wildlife in this part of Botswana.
Hundreds of elephants have been found dead in Botswana's Okavango Delta, but the cause of their death remains unknown. Still, photographs show the dead elephants lying on their sides, others on their front, having collapsed face first to the ground. Poaching has been ruled out as the carcasses were found intact.
Yeah, the word mysterious has been used, and I guess because it's unknown, it's not unheard of to have die-off of elephants and, of course, other species. And one of the likely candidates at first was anthrax, which is common in Botswana, but it's the wrong time of year for that, so that has been ruled out. And that we did have an outbreak in November of last year. So that was ruled out because we've since had good rains. And I'm sure the avenues being investigated are likely to be a bacteria infection or indeed a virus.
Government figures put the elephant death toll at 275, but National Park Rescue said the number is more than 400. Co-founder Mark Hiley calling the deaths one of the biggest disasters to impact elephants this century. According to Hiley, the elephants began dying in huge numbers in early May, but the government was slow to react. With no tests completed, there has been no new information regarding the deaths. Africa's overall elephant population is declining due to poaching, but Botswana, home to almost a third of the continent's elephants, has seen numbers grow to 130,000 from 80,000 in the late 1990s, owing to well-managed reserves.
Still to come on the program. Disposing your refuse right, our Africa Tech segment shows you how with an electronic trash bot. That's in a moment. Please stay with us. Welcome to our Africa Tech segment. A 15-year-old student of Jakonde Estate Comprehensive High School in Ikpaja here in Lagos, Nigeria, has created an electronic trash bot. Abida, with some of her secondary school mates, developed the device to aid the proper disposal of refuse in their surroundings. Take a look.
It's been 3 months since schools closed in March due to the coronavirus pandemic. But just like several other students forced to stay at home, 15-year-old Abida Alabi finds other ways to keep herself busy and stay ahead of her class. Abida, an SS2 student of Jakonde Estate Comprehensive Senior College, Abeson Ikpaja, with some of her schoolmates, have developed an electronic trash bot. Using easily accessible materials, they creatively make one as part of their efforts to make an impact on their immediate surroundings.
We realized this is a school environment. Looking around, you see different dirt materials. So we decided to create something that it would be attractive. You know, most people, they see a dustbin there. Like, that mindset of just going there and dropping it is stressful to them. But when they know the thing will just open, then they throw it in, then they'll be excited to use it.
The e-trash bot is a device that aids the proper disposal of refuse, reducing the cost and frequency of waste collection.
When we want to make the trash bots, the original dustbin, the cover, it's too heavy for the lift to bring it up. So we decided to get something lighter, like waste from a printer's workshop. So we used the waste since it was lighter. Then we cut it into the preferred shape that we wanted. Then we put the sticker all over it. Then we realized it was going to work. Then for the lift, the rope that was supposed to lift it up, not just any rope can lift it up, but then we realized why not use something that's thin and at the same time strong. So we decided to get the trine from shoemakers to lift it up. So that worked too.
Apart from creating the e-trash bots to aid the disposal of refuse and also change the mindset of people in our community, Abida and her team have also developed a smart walker for the visually impaired and a maternal care website.
We decided to just create something that would enable the people to be independent on their own. It comes with a light that will enable other people around the blind person know that someone is coming, and also the buzzer that will alert the person of the obstacle in front. We are working on the maternal care web app. It's a website which enables pregnant women and expecting mothers to have access to certified and quality hospitals and medical health care. Then on the app, we also have the postpartum services, because some people, even after safe delivery, their children still die or they themselves die. So the postpartum service will enable us keeping track with the pregnant woman within 0 to 6 weeks after the childbirth to ensure that the mother and the baby are both safe.
Abida, who would love to become a computer programmer, a writer and a motivational speaker in future, intends to pass whatever knowledge she acquires this period to her peers once schools resume.
When the Angolan government imposed its coronavirus lockdown in late March, local entrepreneur and innovator Claudio Kiala saw a gap in the market when it came to virtual entertainment. Now, Kiala and his team had been developing a performance platform known as Sober Channel app before the crisis struck, where artists would be able to stream live shows and fans would pay to gain access. The lockdown meant they had to accelerate their launch of their app to help artists earn some income during the pandemic.
Soba is the first virtual entertainment platform in Angola that allows artists to charge for their shows and give viewers chance to be entertained in the comfort of their homes, as social gatherings remain prohibited in the country.
When we started working with artists, our main idea was to create other ways for Angolan artists specifically to be respected for their art and to be paid for their art. So we started selling digital music. But then we had this project in which artists would find alternative ways to capitalize from their art. But what happened was that this pandemic situation, led us to accelerate a few of the ideas that we already had, and we decided to create the platform where artists could still host concerts and other types of gathering with their fans and be paid for that.
Popular local DJ Richelli was one of the first to jump on the platform after his income was slashed to zero because of the lockdown.
This virus has brought us a new environment, a new ways to live, and this is a survival way for artists that wants to keep doing their job.
Fans stuck indoors are happy to pay between $2 to $6 per hour, depending on the performer, to see their favorite artist.
It gives me a better experience because I'm alone, you know. I don't have to listen to the other people screaming and doing this stuff. I just have to stand there and watch it. It's better like that.
Performance keep 90% of the ticket cost. A business approach, Kiala says, is more necessary than noble.
It's summertime in Egypt, and a shop in Cairo is selling coronavirus-shaped ice cream to help customers cool down and enjoy a sweet treat during the hot season. Hani Islam says he wants to do something that brings joy to people after several difficult months of confining them to their homes amid the lockdown. And so ice cream is that source of happiness.
As Egypt relaxed restrictions aimed at curbing the spread of COVID-19, customers in a small shop in Egypt's Giza are indulging in cones filled with coronavirus-shaped ice cream. While the pandemic has caused damage worldwide, the shop owner hopes this newest creation would lessen people's fears while stressing the importance of maintaining proper health measures.
The pandemic forced people to be confined in their homes, so we wanted to do something that lifts that burden off. This is also a way to show people that the coronavirus is not a monster. It is just a virus. If you take care, wear your gloves and mask, you won't catch the coronavirus and you'll be okay.
The shop's new dessert takes a round, multicolored shape with thin chocolate sticks and sprinkles stuck to the surface, mimicking the spikes stemming from the outer layers of the virus, a famous microscopic image of the coronavirus causing the COVID-19 disease. Mahmoud Islam, a skilled ice cream maker at the shop, says that some people felt uneasy about it at first, but quickly embraced it, giving positive feedback.
People were of course scared at first, but after seeing this idea, they realized that there is no danger. On the contrary, we're trying to make people less scared with this ice cream.
The shop's latest peculiar addition is drawing more customers in as the government lifts a nighttime curfew and eases restrictions.
Would you be interested in a coronavirus ice cream? I know I would. Well, that's it on the program today. Thank you for watching. I'm Layo Adegoke. Have a great weekend.